So venous disease is actually a progression of venous disease all the way from C1 through C6. I'm going to take a poll right now, actually. And this picture actually shows you a progression of how venous disease progresses from C1 on the left all the way to C6. So I want to take a poll. How many people have a C1 disease? That's the spider veins only, and maybe some dilated blue veins in the leg. That's just the beginning, and it progresses to varicose veins. I want to know how many people have C2. Just type in the chat box. I'm seeing that. Okay, a few people coming in with C1 and C2. C3 is when you actually start to get a swollen leg. You know, for some reason you can't explain why your leg is swollen. Well, that's C3 disease. C4 is when you start getting some skin damage, which is discoloration of the leg. Down from the knee down, starts getting discolored. That's C4 skin damage. Is caused by the hemosiderin in the blood that damages the skin. Well, C5 is when you start to have ulcers in the leg. And, you have these ulcers that could be healed or they could be open and active. C6 is when they're open or active. I see some people saying they have C3. I see a C4. I see one C6 so far. So just tell me, which one do you think you have from C1 to C6? If you just have swelling, that's C3 already. So this is something that you should know. This is a really good slide in the progression of venous disease. All the symptoms you could have of venous disease. So you could not have any of those C classifications, but you may have some of these symptoms. They include restless leg syndrome, lower leg and ankle swelling, achy and tired legs, flaking or itchy skin, inflamed legs, swollen legs like we talked about, cramping in the legs or the feet, dry or thickening of the leg and skin, or leg ulcerations. Well, how do we diagnose venous disease? Well, the first step after a consultation and discussing your history and doing a physical exam is to do a venous ultrasound. Well, ultrasound like it's done when people are pregnant, or ultrasound, we take an image and then look at the veins and look at the valves, see whether they're competent, whether they're competent and preventing the reversal of flow. And if they're not competent, that's the diagnosis of venous disease.